Hello students, this is the second part of the diagnosis and treatment planning in complete denture patients. The clinical examination of the patient. Intraoral examination involves soft tissue and hard tissue, which we have discussed in the part 1. Now we will discuss about the residual alveolar ridge. Residual alveolar ridge arc size involves arc form, ridge parallelism, ridge relationship, hard palate, soft palate, lateral throat form, floor of the mouth, palatal throat form, tongue, frenum attachment, border attachment, and the examination of the mucosa. We will discuss now this in detail. Residual alveolar ridge arc size. According to the house, it is classified as class 1. Class 1 large, best for retention and stability. Class 2 medium, good for retention and stability. Class 3 small arc size, difficult to achieve retention and stability. Next is the arc form. Arc form according to the house is class 1 scare, class 2 tapering, class 3 ovoid. Ridge form. Next is ridge form. Class 1 scare 2 gentle rounded, ideal. Class 2 tapering or V shape. Class 3 involving flat ridge. Now the class 1 is classified as U shape, class 2 V shape form of the ridge, class 3 is flat. Now mandibular ridge form. Mandibular ridge form is classified as class 1 inverted U shape in which parallel walls from medium to tall with broad crust. Class 2 inverted U shape in which short with flat crust. Class 3 can be as unfavorable. Inverted W can be short. Inverted V can be tall. Thin inverted V can be undercut. Result from all teeth in labial or lingual version. Now ridge relationship. According to angle, class 1 is normal, class 2 retrognathic and class 3 prognathic. I have explained what is retrognathic and prognathic in part 1. Ridge parallelism. Class 1. Both ridges are parallel to the occlusal plane. Class 2. The mandibular ridge is divergent from the occlusal plane anteriorly. Class 3. The maxillary ridge is divergent from the occlusal plane anteriorly. Now we will discuss about interarch space, in which class 1 ideal to accommodate the artificial teeth, class 2 excessive interarch space, class 3 insufficient interarch space. Now redundant dent tissue is excessive amount of flabby tissue. These movable tissues tend to cause movement of denture when forces are applied, which leads to loss of retention. Now we will discuss about hard tissue. U shape. It can be U shape most favorable, flat unfavorable, V shape unfavorable. Soft palate. It is classified as class 1 horizontal, which is little muscular movement most favorable. Class 2 soft palate turns toward at about 45 degree to hard palate. Potential tissue coverage less than class 1 for posterior palatal seal. Class 3 in which soft palate turns downward sharply at 70 degree just posterior to hard palate. Minimum potential space for posterior palatal seal. Palatal throat form. According to House, class 1 large and normal in form with a relatively immovable band of resilient tissue 5 to 12 mm distal to a line drawn across the distal edge of the tuberosities, and the class 2 is medium size and normal in form with relatively immovable resilient band of tissue 3 to 5 mm distal to a line drawn across the distal edge of the tuberosities. Class 3 is usually accompanies a small maxilla the curtain of tissue turns down abruptly 3 to 5 mm interior to a line drawn across the distal edge of the tuberosities. So these are the classification class 1 to 3 of palatal throat form. Now lateral throat form. According to Neil, class 1, in which the retromylohyoid flange usually longest, class 2 about half as long and narrow as class 1, about twice as long as class 3. Class 3 minimum length and thickness of the lateral throat form. Gag reflex. Gag reflex. Normal defense mechanism. Prosthetic treatment may be compromised. Causes systemic disorders. Physiological factors and intergenic factors are causes. Careful handling and cost, constant reassurance is important. Bony undercuts. Bony undercuts involve later two tuberosities anterior which do not aid in retention may cause some loss of bordal seal. Now, frenum attachment. Frenum attachment can be classified as class 1 high in maxilla or low in mandible in relation to crust of ridge favorable, class 2 medium, class 3 frenum encroach crust of the ridge interfere with the denture seal tongue. Tongue class 1 normal in size, development and function, class 2 teeth absent from long time permit change in the form and function, class 3 excessive large tongue which leads to problem in impression making, decrease the denture stability. Now we will discuss about the mucosa. Mucosa is the soft tissue in the oral cavity, not a soft part tissue on which the mucosa, color of the mucosa, healthy pink color. Any amount of redness indicates an inflammatory change. Inflamed tissues provide wrong recording while making an impression. White patches should be noted if present on the mucosa. Now we will discuss about the investigations. Investigations involves radiographic investigation, diagnostic cast, current denture. Now the diagnostic cast involves evaluation of anatomy relationships in absence of patient, arc size and asymmetry if any, articular mounted cast, jaw relationship, interarc relationship, undercuts can be seen on the diagnostic cast. Existing or current dentures involve careful observation, reveal denture experience, denture care, parafunctional habits as bruxism. Now treatment plan. Treatment plan involves adjunctive care involving elimination of infection and pathosis, pre-prosthetic surgery, tissue conditioning, nutritional counseling. Prosthodontic care involves complete denture, immediate or conventional tooth selection, shade, mold and material, denture-based material selection, anatomical palate, and evaluation, characterization of denture. Now conclusion. As considered, intelligent effective treatment will meet the specific need of the individual patient. The treatment plan developed for a patient should reflect the dentist's best efforts at interpreting the diagnostic findings. Takeaway message involves proper case history and examination is a significant step in fabrication and success of complete denture processes. Thank you. Please like, subscribe and share.